Good morning. Myself, Dr. Avantika Sri Krishna Bamne. I am professor in the Department of Anatomy, Index Medical College, Hospital Research Center. Now, today in this topic, I will explain about the meninges and how the CSF that is produced, and about the CSF circulation, and applied aspect of the all meninges and CSF circulation. So what are the meninges? Meninges are membranous coverings of the brain and spinal cord, and that surrounds the that lies inside of the cranium, also inside of the from inner aspect of vertebral canal, and also they surrounds the covering, they forms the coverings of the brain and the spinal cord, lie immediately inner to the cranium and vertebral canal. They are from outside inwards. They are Dura Mater, Arachnoid Mater, Pia Mater. Potential spaces are also present in between these layers. The meninges are the membranous coverings of the brain and the spinal cord. Now, so from outside in here, the dura mater. Now, this is the cranial cavity, bone of the cranial cavity. This is outer layer, outer table, inner table, and this diploid is there. And this is the outer this is the bone of the cranial vault, and this is the now so inside of that there is covering of dura mater. The cranial dura, it is in the form of two layers, but the dura mater covering the vertebral canal and dura mater covering the spinal cord and from lining inside the vertebral canal, so that is in the form of only one layer. So dura mater covering the brain here, inside the cranial cavity, which is called as cranial dura, and there it is called as spinal dura. So two layers are there. This is the outer meningeal layer, outer end osteal layer, and inner meningeal layer. Now this is the outer end osteal layer and inner meningeal layer. Rest of the things, it is the two layers get fused, but where there is the formation of dural folds. So inside the dural fold, and how small venous spaces, they are called as the intracranial dural venous sinuses. Now inside of the dura mater there is the arachnoid mater. Arachnoid mater, that consists of the cobweb like appearance of the structure. So now maximum amount of CSF is present in the subarachnoid space, which is present below the arachnoid mater, means between the arachnoid mater and this is the third layer, that is the pia mater. Between these two layers there is the subarachnoid space, and in the subarachnoid space the major content is cerebrospinal fluid. But along with the cerebrospinal fluid, all the large vessels and blood vessels supplying the brain, they lie in the subarachnoid space. That means arteries and the major arteries and the brain and veins supplying the brain, they lie in the subarachnoid space. So here we can see the artery and the vein, how the accompanying artery and the vein, they are present in the subarachnoid space. So along with the CSF, in the subarachnoid space, all the major blood vessels supplying the brain, they are present. Now this is the pia mater. Now this is the pia mater, thin layer, thin, delicate, transparent layer, and which is present below the arachnoid matter. This is the third innermost layer, and how it covers the all the surface irregularities of the brain. It covers all the elevations, they are called as gyri, and it is very faithful. It goes deep and deep inside the fissures also, sulci also, and it covers the sulci also. So this is the pia mater. From outside in, suppose there is the bone, that is the cranial vault, then there is the dura mater, cranial dura. It is in the form of two layers, cranial dura, and then outer endosteal layer which snugly fitted over the endocranium, and now this is the inner meningeal layer which forms the folds. Now so here this is the arachnoid matter, blood vessels, and in the subarachnoid space CSF is present, and now this is the pia mater. Now, so from outside in, which are the coverings? Suppose this is the skin of the skull, that is from outside in when we go. This is the skin of the skull. This is periosteum. Now, there is the bone is there, outer covering of the bone and inner cortex of the bone. Outer cortex or outer table it is called as, an inner table, and then there is the spongy bone lying between two, and that is called as the diploe. Then there is the dura mater. Now, so endosteal layer of the dura mater, which is snugly fitted over the endocranium, and now this is the meningeal layer of the dura mater. So now enclosing between the two layers, here largest and triangular in cross section we can see lying along the sagittal suture. So that is the superior sagittal. हेलो हेलो हाँ मैं डॉक्टर अवंतिका बामने बात कर रही हूँ हाँ लंच ब्रेक कब होने वाला है मैडम बताइए प्लीज लंच ब्रेक बच्चों का 4th क्लास अच्छा कोई बात नहीं अभी 12 o'clock को ही छूट रहा है वैसे बट मैं टाइमिंग के लिए पूछ रही थी कि लंच देगा ना लेकिन देंगे ना बट ठीक है ओके Now this is the dura mater. Now so here is the superior sagittal sinus. Now this is the subdural space and this is the subarachnoid space. So below the dura mater and between the arachnoid mater there is the subdural space, and now here is the subarachnoid space. So in the subarachnoid space all the blood vessels you can see, and now the fold between the two cerebral hemispheres, this fold of the meningeal layer, it is called as the falx cerebri. Subdural space filled with a capillary layer of fluid intervenes between the dura and arachnoid. Subarachnoid space between the arachnoid and the pia mater filled with the cerebrospinal fluid. Now, wherever there is large pools or large collection of the, means suppose there are some enlarged spaces where the CSF is um, present, and the enlarged subarachnoid spaces at some places it is called as cistern. These are called as cisterns. Now bleeding in the spaces, this is called as the brain hemorrhages. Bleeding in the spaces, extradural hemorrhage, rupture of the meningeal vessels due to fracture of the skull bones. Now, what will be the most probable cause of subdural hemorrhage? So, in case of subdural hemorrhage, venous in nature and tearing of the cerebral veins, so that may be the cause. So, tearing of the cerebral veins, that is subdural. Subarachnoid hemorrhage means inside the subarachnoid space. Subarachnoid hemorrhage mainly arterial injury to branch of the internal carotid artery or vertebral artery. Dura mater is also called as the patchy meninges. Patchy means thick, tough, thick, non-elastic fibrous membrane. Cranial dura. Cranial dura has two layers, outer endosteal and inner meningeal. Outer endosteal act as inner periosteum, so extradural or epidural space is absent in case of the cranium. Around the spinal cord, dura mater is of meningeal layer only, so extradural space is present in the vertebral canal. Now folds of the dura mater. So this is the falx shaped fold. It is called as the falx cerebri, falx cerebelli, tentorium cerebelli, and this is the diaphragma celi. These four are the folds of dura mater. Falx cerebri, that forms the partition between the two cerebral hemisphere. It gets lodged in the median longitudinal cerebral fissure, and this is the tent-like folding of the dura mater, that is called as the tentorium cerebelli, how it forms the roof of posterior cranial fossa, and it divides, means it just separates the occipital lobes of cerebral hemisphere from the underlying cerebellum. Now lodged inside the attached margin of falx cerebri, there is the superior sagittal sinus. On the free margin of um, falx-shaped this falx cerebri, and there is the inferior sagittal sinus. Now this is the tentorium cerebelli. This is the straight sinus. These are the transverse sinuses. Here is the cavernous sinus is present on each side of the sella turcica. Sella turcica is the superior hollowed out portion of the superior surface of body of sphenoid, and this is the cavernous sinus. This is the cavernous sinus. Spinal dura mater, above it is attached to the circumference of foramen magnum. Below it becomes thinner at the level of S2 and it will end. So subarachnoid space also ends at the level of S2, invests the phylum terminal to attach at the back of coccyx. So attached to the circumference of the foramen magnum, below becomes thinner at the level of S2 level, invests the phylum terminal to attach at the back of coccyx. Arterial supply to the meninges, branches of the internal carotid artery, the meningeal branches of the ascending pharyngeal artery, meningeal branches of maxillary artery and vertebral arteries. So that is the arterial supply. The nerve supply, branches of the trigeminal nerve and vagus, branches of the trigeminal nerve and upper vagus nerve and upper three cervical nerves. Arachnoid mater, a delicate membrane between the dura and the pia mater, do not follow the sulci and the fissures except the longitudinal fissure of brain. Consists of the mesothelial cells supported by connective tissue fibers. Blood vessels penetrating the brain, mesothelial cells supported by the connective tissue fibers. Blood vessels penetrating the brain receives a tubular prolongation of arachnoid and the pia mater with the subarachnoid space known as Virchow-Robbins space. Blood vessels penetrating the brain receive tubular prolongation of arachnoid and pia with subarachnoid space. Now, what are the modifications of arachnoid matter? What are the arachnoid villi and arachnoid granulations? So, arachnoid villi are reabsorbed into the venous system along arachnoid villi and arachnoid granulation that project into the dural venous sinuses, mainly superior sagittal sinus. Cerebrospinal fluid is present inside the dural venous sinuses, the arachnoid villi and the granulations. So, during the circulation, now arachnoid villi and the granulations, how they form important structures which reabsorb the CSF and back into the venous system. So subarachnoid villi and the granulations, later on they will form the surface projections and they forms the pits or fovea on each side of the sagittal suture on the interior of the cranial vault. So now these are again mesothelial lined arachnoid villi and the granulations and responsible for absorption of the CSF back into the venous system. So this is the cross section of superior sagittal sinus. Spinal arachnoid matter, a thin delicate tubular membrane loosely investing spinal cord. Above it is continuous with the cerebral arachnoid matter. Above it is continuous with the cerebral arachnoid matter. Now what is the subarachnoid space where it ends between the pie and the and the arachnoid matter. There is a space is present called as the cerebrospinal fluid, containing the cerebrospinal fluid, that subarachnoid space. Now what is the terminal cistern? It is called as largest part of the subarachnoid space, largest part of the subarachnoid space extending from termination of the spinal cord to level of S2. So largest part of the subarachnoid space extending from termination of the spinal cord to the level of S2, where it is occupied by nerves of the cauda equina. So it is the best site for lumbar puncture. Now what is the procedure known as the lumbar puncture? So how the spinal cord ends at the level of L2, subarachnoid space ends at the level of S2. Now next, this is the procedure of the spinal puncture, lumbar puncture, or also called as the spinal tap. The person, so what will be the indication for withdrawal of the cerebrospinal fluid? So lumbar puncture is done for the diagnostic as well as therapeutic procedures. It is procedure where the cerebrospinal fluid circulating in the subarachnoid space well below the level of end point termination of the spinal cord, that is at the level of lower border of the L2. So disc space means the spinal space, that space between the spines of vertebra L4 and L5, or L3 or L4, and most commonly preferred site is between the L4 and L5. So the person is that patient is asked to flex his spine and lie on a lateral position, and so flexion of the spine causes that interspinous spaces, they will just open up, interspinous spaces open up. Now here is the what is at the tip of all the spinous processes, that is lined. So this is the supraspinous ligament is there, then these are the interspinous ligaments and muscles are there. Now large bore lumbar spinal puncture needle that is introduced between the, now this is the L2, and here is the lower border of L2, there is end termination of the spinal cord. So most commonly preferred site is between the L3 or L4 or L4 or L5. So the needle is introduced, skin, fascia, and then there is the resistance is felt by the supraspinous ligament and interspinous ligaments, and muscles are there, and then slowly there is sudden loss of resistance, so that now we are in the subarachnoid space. Now subarachnoid space, whatever the around the spinal cord, it is there, and it will end into the S2 level. And now here the large pool of that large terminal cistern is present, or pool of CSF is present, from which for the diagnostic as well as therapeutic purposes that cerebrospinal fluid is withdraw now, or giving the spinal anesthesia, or for introduction of some anesthetic agents, this is the most commonly preferred site. And for the diagnostic purposes, suppose in case of the meningitis, in case of bacterial meningitis, in case of the pyogenic or tuberculous meningitis, so now how the investigation that is made, and how the lab testing of the cerebrospinal fluid for its physical properties, whatever there is alteration in the gravity, or alteration in the protein content, and alteration in the sugar content of the cerebrospinal fluid, and then this is called as the lumbar puncture. This is called as lumbar puncture. So slowly the needle is introduced between the L4 and the L5. There is first of all there will be the resistance while piercing the ligaments and the muscles, and then there will be sudden loss of resistance. So assume that now we are in the subarachnoid space. Then here the stellate is removed, and from the cannula now slowly drop level of the cerebrospinal fluid we can collect, or either we can introduce any anesthetic agent or any medicines or drugs for the therapeutic purposes. Now, so these are the cisterna ambiens. Now, this is the cerebellomedullary cistern at the junction of the pons and the medulla, and on the inferior aspect of the here cerebellum there is the cerebellomedullary cistern. Now, in front of the this pons there is cisterna pontis. In the interpeduncular fossa there is the interpeduncular cistern, and then this is the cisterna ambiens. Now here is the cisternal puncture. Suppose any contraindication for the lumbar puncture. If lumbar puncture method fails, procedure fails, then there is the cisternal puncture. So in the suboccipital triangle here, there is the means in the cistern, in the this cistern, that is called as the cisternal puncture. Interpeduncular cistern is the between arachnoid mater, spans between two temporal lobes, contain the circulus arteriosus. Cistern of the great cerebral vein, cisterna ambiens, occupy interval between the splenium of the corpus callosum and superior cerebellar surface. Great cerebral vein traverses the cistern. Pineal gland protrudes into it. Pia mater is the arachnoid and the pia mater collectively called as leptomeninges, thin vascular membrane investing all the contours of the brain and the spinal cord. Closely invests the brain surface in some areas of the pia mater. Invaginate into the ventricles to take part in the formation of choroid plexus. Cerebral pia mater, it presents the tila choroidea and choroid plexus. Tila choroidea is bilaminar fold of the pia mater covered by ependyma and present along roof of third and the fourth ventricles, and in the medial wall of the lateral ventricle along the line of choroid fissure. So it presents tila choroidea and choroid plexus. Tila choroidea, which give rise to highly vascularized choroid plexuses from which cerebrospinal fluid is secreted into the ventricles. Choroid plexuses are located in the lateral ventricles, the third ventricle and the fourth ventricle. Anterior horn. So this is the lateral ventricle, showing this is the lateral ventricle. Now this is the interventricular foramen. This is the then third ventricle. Then it is the aqueduct of Sylvius. This is fourth ventricle. And then this is the opening in the spinal central canal. Cerebrospinal fluid, clear, colorless, odorless, liquid, fills the ventricle and subarachnoid space. Total volume 150 ml, 30 ml in the ventricular spaces, remaining 120 ml that circulates in the subarachnoid space. Specific gravity 1007, pH that is the 7.35. Now daily production of almost 500 to 600 ml of the per day production of the CSF that takes place in the subarachnoid, means in the ventricular system. So is 4 to 5 times a day daily turnover takes place. So this CSF has to be circulated throughout the day. Now maximum quantity about 80 to 90% of the CSF production that is taking place inside the lateral ventricles. Remaining 10-20% of the CSF production that occurs in the third ventricle and the fourth ventricle. Now what is the cerebrospinal fluid? How it's secreted? how it circulates. Now choroid plexus, this is the choroidal plexus which is present in the lateral ventricle, as well as choroidal plexus which is present in the fourth ventricle. CF is secreted by the choroidal epithelial cells, which are acting as a modified epithelial cells of choroid plexus, and in the lateral, third and the fourth ventricle. Choroid plexuses are vascular fringes of the pia mater covered by cuboidal epithelial cells. So here now this arrow, green color arrow shows now animation of how the CSF is secreted in the lateral ventricles. That is, in the lateral ventricle CSF is secreted, then it is now going towards the third ventricle. This is the third ventricle. From the third ventricle, now this very narrow space, slit like space of the aqueduct of Sylvius, and now ultimately it comes in the fourth ventricle. Now from the fourth ventricle here, from the fourth ventricle, now it is going, and from the foramen of Magendie and foramen of Lashka, it escapes into the subarachnoid space covering the spinal cord. Now it goes all over the surrounding of the spinal cord, then it ascend upward in the cisterna pontis, and then it ascend now inside the subarachnoid space covering the brain, and ultimately now these are the smaller structures, arachnoid villi and the granulations, through which it is reabsorbed into the venous system. It is reabsorbed into the superior sagittal sinus. Now circulation CSF drains from the lateral ventricle, interventricular foramen, third ventricle, aqueduct of the Sylvius to the fourth ventricle. Then median and the two lateral apertures are there, and the subarachnoid space. To the arachnoid granulations, subarachnoid space covering the brain, and arachnoid granulations, and ultimately into the superior sagittal sinus. So lateral ventricle, almost 80 to 90% of the CSF that is produced in the lateral ventricle through the interventricular foramen of Monro. It goes in the slit-like cavity between the two thalami, thalami, and that is vertical slit-like cavity called as the third ventricle, from which it is circulated into the fourth ventricle, connected to the fourth ventricle via aqueduct of the Sylvius, and then from the fourth ventricle by median and two lateral apertures, it is converted into the, means it is going inside the subarachnoid space covering the spinal cord, subarachnoid space in a continuation covering the brain, and then which are the arachnoid granulations, the structures they are present along on each side of the sagittal sulcus, and then superior sagittal sinus is present in the sagittal sulcus, and arachnoid granulations now they are going inside the superior sagittal sinus. Now, which are the functions of the cerebrospinal fluid? Cushion between the CNS and the surrounding bones. Now, this cerebrospinal fluid act as shock absorber. What is the buoyancy effect? So that weight of the brain becomes less. So anything heavy object or any heavy weight bearing subject, when it is dipped inside the water, so the weight is become less. So buoyancy effect of the CSF causes weight of the brain, because 1.5 average 1.5 kg is the weight of the brain, and now that it will not be failed because of the buoyancy effect of the brain. Maintains the intracranial volumes, nourishment to the CNS, removes the metabolites, autoregulation of the intracranial pressure. Cerebrospinal fluid circulation. Now from the lateral ventricles, secreted by choroid plexus of the lateral ventricle. Almost all the 80 to 90% of the CSF that is produced, it is going inside the third ventricle, from the third ventricle to the fourth ventricle via aqueduct of the sylvius. Then again rest of the CSF is produced by choroid plexus, which is present in the fourth ventricle. Then here it escapes and around the from the fourth ventricle via the midline aperture called as the foramen of Magendie and foramen of Leshka are the apertures from which the CSF escapes the ventricular system and enters inside the Dura Mater covering enters inside the subarachnoid space covering spinal cord. Then there is the subarachnoid space and covering the brain. Then it is going towards the arachnoid villi and granulations, and ultimately how it is reabsorbed into the circulation again.